Hi, welcome to the Medicare training series, where today we're going to be talking about Medicare special needs plans. They'll be both the C and D type plans. So just to kind of get things rolling, it's like, what is a special needs plan? Okay, a special needs plan is a Medicare Advantage plan. That's a coordinated care plan specifically designed to provide targeted care and limited enrollment to special needs individuals. Now, a special needs individual can be any one of the following. It can be an institutionalized individual, a dual eligible, meaning both Medicare and Medicaid, or an individual with severe or disabling chronic conditions, and those we'll cover those. They're going to be those that are specified by CMS. So like I said, it's a type of coordinated care plan, and it's either a local, regional preferred provider organization, or an HMO type plan. It can even be an HMO point of service. Okay, so it can be any of those types because it's going to be the Medicare Advantage, and it's limited to those three. And there are three different types of plans. Okay, there's like we said, the chronic condition and the dual eligible. The third one is the institutional. Okay, so now, as it turns out, we will not be discussing the institutional because those are reserved for by the various healthcare companies to be handled just by them. They just don't let the independent agents handle the I-SNP, okay, and that's why we won't really be talking about those. And we will really concentrate on the dual eligible, that's for both Medicare and Medicaid. And you need to really be aware of the C-SNP because that one can really solve the problem with looking for an SEP, and you've discovered that your customer does have one of those chronic conditions. So it's just one of those that you're going to keep there in the toolbox to be able to use for that. So our agenda here for today is kind of, like I said, we're going to look at those D-SNPs. We're going to discuss, Medicaid and the Advantage plans. We'll have to touch on some LIS just because it borders in on this. Then we'll really break down those chronic needs plans. And then we'll close from there and answer any questions. I really hope you'd hold all your questions to the end. And yes, this will be saved to the library, so you can go back and use it as a reference, or you can refer somebody back to this webinar if they start asking you questions and you need some more information. So we'll just kind of start back with Medicare. By now you should be knowledgeable as just what's covered by both Medicare Parts A and B, and that there's an unlimited 20% cost share associated with Part B. And one must have Part D to cover prescription drugs, or you'll face a penalty. Okay. So Medicaid, on the other hand, and this would be for the the dual eligible. Now the states themselves may vary a little bit in determining their eligibility categories. Therefore, there may be some very state-specific differences in eligibility, levels of comparison. For specific information regarding Medicaid eligibility categories, we need to go look at the Medicaid website. But with kind of broad national guidelines that were established by the federal government, each state, does establish their own eligibility standards, so they can vary. That's like I was saying, can vary from state to state. Determines the amount or the type, the amount and the duration and scope of services. So, that's why I was saying, and a part of this is it really gets down to not just the state, but right down to the county level, because this is actually administered right down there at that county, and it usually sees things that says like Health and Human Services or something like that. And they'll set the rate of payment for services. and administer the program. So when we kind of pair them together, remember that Medicare is the only health insurance that's going to be available once a person turns 65. And with that little caveat that if they remain covered by an employer-based plan, and that Medicaid is a state-controlled plan and can go by many different names depending on the state. Out in California, they will call it Medi-Cal. In Arizona, it's referred to as ASSESTS, and that's an acronym. I don't remember what all it stood for. They call it TennCare in Tennessee. It's just that it's managed, like I said, by each state, and each state will have a name for it. Some will even actually call it Medicaid, but it's right down there at the county level. Yeah, there are some terms that are used in Medicaid that you're just going to have to kind of familiarize yourself. When a Medicaid recipient first gets their letter from Medicaid, it tells them the level of coverage that they're going to receive. And this refers to the various levels of help from Medicaid. The terms can vary slightly from state to state. And as the agent, you need to know specifically their level of Medicaid in order to fully assist in plan selection. The only other status that provides the true, actually it says, I was getting at, is the only status that actually provides true benefits. And we'll get more into this in a little bit, but the status of QMB plus or SLMB plus. Okay, and all these other statuses may have some level of cost share associated with them. But those that will get literally everything at zero cost, it's going to be the qualified Medicare beneficiary with full Medicaid or the specified low-income beneficiary with full Medicaid. Both cases referred to as either QMB plus or SLMB plus. Now, the qualified Medicare beneficiary program, that's QMB, it means that they're recognized as being, part of Medicaid. Now, any one of these designations may not be good enough to get into a plan, one of the dual eligible plans, more on that coming, but it will give them the special election, the SEP. Okay, so you'll still be able to help them, get into a plan. Yeah, like I was saying, the qualified Medicare beneficiary that has their assets that maybe are just a little too high to qualify for full Medicare, as a dual eligible, but whose income is at or below, 100% of federal poverty line, and whose countable resources do not exceed $4,000. Again, these can be very state specific. It could be, I think I've seen it as low as $2,000. But they could be eligible to have, Medicaid pay their Medicare cost sharing requirements. Okay. And that would include their monthly premium for Part B coverage, as well as deductibles and coinsurance, up to the Medicaid payment amounts. When they have plus on there, not only do they have that QMB, where they're, could be getting their Medicare cost covered, but they're going to also get everything provided by Medicaid. Okay? And so that's why it's important to have that plus on there. Now, we may have heard of this thing called the Medicaid spend down. Now, here's kind of the way that works. For most Medicaid eligible categories, having countable income above a specified amount would disqualify the individual from Medicaid. However, in some of these eligibility categories, and most notably the one that we're dealing with is called the medically needy. So individuals may qualify for Medicaid coverage even though their countable income is higher than the specified income, set by the standard. And what they will get is called a spend down. Now, under this process, the medical expenses that the individual gets, okay, during that period, and then they usually break it down to by the month, okay, that are going to be deducted from their income. So I'll give you an example. We'll just say that you made, $200 a month too much to qualify for Medicaid, but you are determined to be medically needy. So they would give you a $200 spend down, meaning that on each month, once your expenditures reach that $200, then your Medicaid would kick in and you would receive the Medicaid benefits for the rest of that period, for that month. Okay. So medically needy, now that's the term that is used in Medicaid eligibility to get they're just determined to have high medical expenses, but they otherwise would not have qualified for Medicaid because their income's too high. And so they're just given that opportunity to reduce their income through their medical expenses. Now, states that elect to cover medically needy do not have to offer the same benefits package as they do to the categorically needy. In other words, those who don't make enough money. So dual eligible. So what they say, and this is what describes the various categories of individuals who collectively are known as the dual eligibles. So Medicare has two basic coverages. Part A, which pays for hospitalization costs, and Part B, which pays for physician services, lab, x-rays, durable medical equipment, outpatient, and other services. The dual eligibles are individuals who are entitled to Part A and or Part B and are eligible for some form of Medicaid. Okay? That's why I was saying it doesn't matter if they had any of those terms that we looked at, if that letter that they received shows that they're receiving something from Medicaid, gives them the SCP, and gives them that designation of dual eligible. So what are the dual eligible special needs plans? So QMBs with full Medicaid, that's the QMB plus. These are individuals that are entitled to Medicare Part A, have income of 100% of federal poverty level or less, and resources that do not exceed twice the limit for SSI eligibility. That's kind of one of their terms, and are eligible for full Medicaid benefits. Medicaid pays their Medicare Part A, if any, pays their Medicare Part B premium, and to the extent consistent with the Medicaid state plan, it pays the Medicare deductibles, co-insurance, and provides full Medicaid benefits. Federal financial participation equals the federal medical assistance percentage. Well, we won't really get into that because it's not necessary. But you could have any of these designations, the SLMB with full Medicaid, SLMB plus, or any of the other ones. It could be, qualified disabled working individual, QI, QMB, SLMB. I mean, there's just so many of these little designations. As long as they have one at all, they fall under the dual eligible. The question would be whether or not they're going to get full Medicaid or not. Okay. But that doesn't change whether or not they are eligible for the plan or if they're eligible for the SEP. So who qualifies for this? Okay. So the Qualified Medicare Beneficiary Program, the Specified Low-Income Medicare Beneficiary Program, Qualified Individual Program, all help Medicare beneficiaries of modest means pay for some of Medicare's cost-sharing amounts. Okay. premiums, deductibles, and co-payments. Now, the QMB Plus is an individual that not only meets, the qualified Medicare beneficiary, but is also eligible for benefits covered through their state's Medicaid program. Yeah, there's only going to be two groups that fully are going to be able to get, both Medicare and Medicaid to the fullest extent, and that's, as I've said before, is the QMB Plus and the SLMB Plus for sure. The others may be eligible for some, depending on what they got, but we'll just have to get into the plans to see exactly what that is determined to be. So this is the chart, and we all probably have seen this before, but this is the one for 2020, the federal poverty level. Now, all calculations are really based on this chart. As you can see, it's based on a combination of household size and income. Now, the income must be less than 135% of federal poverty level. And you'd simply be surprised by the number of seniors raising grandchildren or still have children at home. And so that family size along with income can really make a difference. Now you notice that this is only for the 48 states and District of Columbia. For those who are operating in Hawaii or Alaska, there's a separate chart. But if you're operating there, you probably already know that. Now, Social Security benefits are pretty modest. And Social Security benefits are really, I'd say, more modest than most people realize. The average Social Security retirement benefit check, and this was as of June of 2019, was about $1,470 a month. And that turns out to be about $17,640 a year. Now that's greater than the 135% of federal poverty level for one person. But if that's the average, you know that there are far more receiving a whole lot less than that. Okay? So with that monthly benefit of just $1,470, the idea of retiring in Social Security alone may sound next to impossible, but still, 23% of married retirees and 43% of single retirees count on Social Security as 90% of their monthly income. So you can see that we're probably looking at pretty large numbers of people that are going to fall into these categories. So because the customers can change each quarter, you'll need to follow up with them. They can and will change with or without you. So be sure to cement this relationship. Put them into your program and maintain contact. Just a couple of minutes each quarter would definitely be well worth the effort, because these people can literally make a change every 3 months until that, until the last quarter, and then they'll just be doing it as part of the annual enrollment period. But in areas that have multiple special needs plans available, you'll find that these people just kind of jump around from plan to plan. Could be in multiple ones each year, one based on the last person that they talked to. You need to convince them that you are the only person that they should be talking to, and not to make any changes without talking to you first. So now you're going to have to verify your person. Okay? Now, before completing the enrollment, you'll need to verify a level of Medicaid with the carrier. So there are several ways to conduct the verification. Now, this particular one is from UHC, but with UHC, Cigna, and Humana, you're going to call broker services, and they have a team that does Medicaid verification. Okay. So you'll literally, call them up on the phone. You're going to need some information from them. You're going to need to know, their full name, their date of birth, usually either their Medicaid number or their Medicare number, either one. And they'll be able to go in, look in the system, because they'll have access to that. and be able to verify. So that's those ones for sure. You're going to do it over the phone. There's some other ones like Anthem for one. Let you do that verification yourself online. Okay? So you're going to complete this it's literally part of the application with Anthem, and if at any point on there it shows that there's one that says eligibility check Medicare and Medicaid, but the way you could be in quoting, or you can literally be in the application, and it will let you link over to the verification process. You definitely want to do this because you want to save the time and effort that you've gone through. Many of our customers don't truly know the level. They don't have that letter anymore. They never hung on to it. I don't know how many times I've called in with a customer and had to solve all kinds of problems, whereas if I'd simply completed the application and sent it in, it would be denied, and I've just wasted a whole lot of time. So I'm going to save you that time. You do need to go ahead of time and verify with them. I do need to touch a little bit on what to do if there is not a D-SNP available. Okay? Let's face it, they're not everywhere. I know in my area there is no D-SNPs at all. Okay? Where I live in Oregon, there's just not one available. So if there's not a D-SNP in the area, that didn't change the fact that they were dual eligible and had the SEP. Okay, so you can still put them into a Medicare Advantage plan. You do have to caution you to look up the doctors to make sure that the doctors are part of the network. Now, if the doctor accepts both the plan and accepts Medicaid, even if the plan calls for a copay, there would be no copay. Okay? And for those who do have a spin down, remember, even having the spin down gave them the SEP, but having an Advantage plan over original Medicare would be able to save a whole lot of money and hopefully never really have to exercise that spin down portion. I mean, they would never have just a few little copays, if at all, and get that simply taken care of at no cost at all to begin with. Now, there are a few states that participate in the, the Medicare-Medicaid Alignment Initiative. So we have to look out for those. In Illinois, even though that they have that in place, the only available in, the greater Chicago and then in central Illinois. And in fact, it's really like 15 counties out of 102 where the Medicare-Medicaid Alignment Initiative goes, and that's a demonstration project for the dual eligible. And they can only enroll in that through the county there. Now, as of February of 2017, there was about 39 different areas, covering in 8 states: Arizona, California, Idaho, Massachusetts, Minnesota, New Jersey, New York, and Wisconsin. So that is the only ones that have this initiative operating in them right now. So even still, for those, they can opt out, and you can put them in just a regular, Medicare Advantage plan. As far as the enrollment goes, it just kind of gives you a picture here. Like 1 in 5 Medicare beneficiaries is also on Medicaid, so that's 20%. Okay? That's according to the Kaiser Family Foundation, and these stats were as of October of 2019. So that 1 in 5, or 20% of Medicare beneficiaries, are literally on some level of Medicaid. I call this one kind of the lay of the land. This map shows the concentrations of the Medi-Medi eligible with a dual plan available. That's kind of just the layout there. So you can see that in some of the areas like Florida, Tennessee, and Arizona, large percentages of the population are in Medicaid and Medicare at the same time. So let's take a look on how to check if the beneficiary is on Medicaid. Yeah, there's a few things that you're going to need to know. Like I said, you have to get this information from the beneficiary. It's going to be their zip code, their Medicare number, at least their last name, their Part A effective date, and date of birth. Hopefully you don't run into any of those oddballs like I did when I was out there selling, where they're just were born off in the very rural areas where the birth date is actually not quite known. In other words, they may have been. I had one customer who had a birth date that they knew was her birth date, but the midwife who delivered her hadn't got around for another month before it got registered with the county at that time. So there was a couple of different dates floating around as to what the actual birth date was. So those are the ones that are going to have to go down to Social Security and go down to Medicaid and kind of get those all resolved. Unfortunately, they usually have to do that in person. And I've also been in that situation of I've led the horse to the water, but I can't get them to drink any of it. And so I just simply, would continue to call them and try to work with them, but I've had a few that just would never do what they needed to do. So once you have that information, we can go into Medicare.gov, and this is that opening page there. And what you're going to do is, I noticed over there in the upper left-hand corner, it says sign up or change plans. Okay. If you hover over that, it'll open up like that. And you want that one where it says check your enrollment. Okay, so the bottom side, so the upper left, when you hover over it, it opens it up. And that bottom one lets you go in and check the enrollment. So once you've done that, this is the screen that's going to pop up. At this point, they either already have a username and password and they can give that to you, and you can go in and take a look. CMS has asked us specifically not to simply create these. Now we can assist the individual, but we're requested by CMS not to just create an account for an individual, but it does allow us to assist them in setting an account up. And once you have an account, it would open up and give you your enrollment status. Now, this particular one shows that the person was enrolled in just the Humana Preferred RX plan and had no subsidy at all. It was not eligible for any subsidy. Where it says no subsidy, it would literally list what subsidy they're eligible for. This is not the final word. That's what that verification process was for, because this tends to lag the states by several weeks, even months, as far as when somebody has left the program because maybe they were no longer eligible. Can be several months even before it shows up in that subsidy status on this. But this is a good place to take a look to see what it says they are eligible for. Now, we can't, not really discuss. We've had a whole separate webinar on low-income subsidy. It should also be available here, in the library if you would want to go check that one up. But there's some of the things that we need to just touch on while we're talking about the dual eligible, because they will also be included. Okay. So all dual eligibles will still have LIS. If they lose their Medicaid, and they will still have their LIS at least until the end of the year. So we'll touch a little bit on LIS, like I said, federal program. This is that one that's known as Extra Help, and it does help pay for drugs. The monthly premium, annual deductible, and reduces your co-insurance and co-payments. As far as how it works, I would really refer you back to the LIS webinar. It should be in the library to take a look at. That'll really break it down a whole lot more as to how it works. But basically, it helps them get their prescriptions at a whole lot less cost. We can pay the amount of the premium for the Part D plan, and it can pay the deductible for the Part D plan, and it can reduce the cost of drugs to, depending on exactly which one you're taking, no more. These are maximum copays of $3.65 for something generic, and a maximum copay of $8.95 for something that's brand name. Okay. Yeah, it doesn't relieve them of not having that in the formulary of their plan. It's not going to pay for anything that's not in the plan's formulary, so it still has to be part of the plan. Now, they estimate the value of being in extra help worth almost $5,000 each year. And one of the things you're going to find out is many people are eligible for these to be participating in this plan and don't even know it. The amount of money you're allowed to make and a lot of assets that you're allowed to have are far greater than the Medicaid amounts. So if you qualify for Medicaid, you definitely qualify for extra help, but it doesn't work the other way around. So we do look at who is eligible. So these are the ones that are automatically receiving the extra help, or the LIS. And you don't even need to do an application, and that's if they're receiving Medicare and Medicaid. If you find that the person has their Medicare premiums being paid for by the state, so they're part of one of the Medicare savings programs, that's still part of Medicaid, they just may not be receiving full Medicaid benefits. And if the beneficiary is receiving SSI, okay, and has Medicare, they're going to also have the low-income subsidy or the extra help. Like I said, the asset, as far as then who is going to be eligible, is simply going to be based on income, resources, and assets and household size. So the beneficiaries, you still have to complete and submit an application, and depending on their income and assets, they will qualify for either full or partial extra help. Even having partial will be a great benefit to most people. Like I said, the asset limits are much different, so you're literally allowed to have a whole lot more and still qualify for the low income subsidy. All right, so there's some resources that are available to assist you, and that starts with that one for SSA.gov, benefits, -Medicare, -prescription. That's the preferred method to enroll. Now, one of the things that you're going to find when you get in there to do that enrollment for extra help, it's going to also ask if you want to apply for Medicaid. In fact, it actually is one of those negative. It will automatically apply on your behalf for Medicaid unless you click a box that says don't do it. Okay, so the application that they would either get into Medicaid if they didn't have it already, or to get extra help is actually the same process. Okay? So you can do it either online, that's the preferred method. You can call Social Security at 1-800-772-1213 and do the application over the telephone. My experience has been you got about an hour wait before you're going to talk to anybody to do that, 10-15 minutes to do the application. And the final choice would be to actually go down to the local Social Security office. That's usually the last choice in my book because it's going to take up half a day for you, and you're going to have to be down at Social Security. As far as doing just Medicaid, you just go down to your local Health and Human Services office. That would be at the county level. So, like I said, there's a lot of other programs out there that are available, and I'd always start with that one for extra help because that will get a lot of the process going. Like I told you earlier, is submitting the extra help application. We'll also send the information to the state unless you indicate not to on the extra help application. And the state will contact the beneficiary to help them apply into the Medicare savings program. So after applying, usually takes 3 or 4 weeks, Social Security will send a letter to the beneficiary, and it can be color coded. And so that's kind of their color coding there, which I hope is going to be in that purple, which says that they're going to be qualified for just about everything. Now, one of the things that I used to like to do was I would make sure that I had their information so that I could log into their account, because as you see here, it's going to be 3 or 4 weeks before you get the letter. Well, it usually only takes about 2 weeks before it actually shows up online as being enrolled, as qualifying for either LIS or for Medicaid. And I would love to be the one making that phone call to them saying, hey, I've got some great news. Looks like you qualify for the extra help or for LIS or for Medicaid. Let's get you enrolled, and then go ahead and start the process of getting it enrolled. You don't have to wait for that letter. If you have their login, and you can go in and look. So that's really all about the dual eligible. So let's take a look here at the C-SNP plans. Okay, now the D-SNP was for the dual eligible. The C-SNP are for those with chronic conditions. Like I said on the slide here, it just says helping beneficiaries with severe chronic conditions using a targeted approach. So now C-SNPs what they do is they restrict their enrollment, to special needs individuals that have a specific, severe or disabling chronic condition. Approximately 2/3 of the Medicare enrollees have multiple chronic conditions, requiring coordination of care among primary providers, with their medical, maybe mental health specialists, inpatient, outpatient facilities, extensive ancillary services that are related to diagnostic testing and therapeutic management of their specific condition. These plans, the doctors and drug formulary, are tailored to that specific chronic condition. Okay? So now that I've talked about these chronic conditions, let's kind of break them down and see exactly what they are. And there are literally 15 different chronic conditions that we can have a special needs plan on. Okay. And so as you just kind of go through here, you see that there's the alcohol and drug dependence, autoimmune disorders. Now they're limited to just a few of them, like lupus, rheumatoid arthritis, but there's a whole list. There's a list of which autoimmune disorders qualify. Cancer, but it excludes pre-cancer conditions or in situ. Cardiovascular disorders, but now again, these are limited to like cardiac arrhythmias, coronary artery disease, peripheral vascular disease, and chronic venous thrombotic disorder. It could be chronic heart failure, dementia, diabetes, end-stage liver disease. Now, we always talk in that there's not going to be available, to enroll in a Advantage plan if you have ESRD. Well, if there is a special needs ESRD plan, which is a type of Advantage, they are eligible to have ESRD requiring dialysis and enroll in this particular type of Medicare Advantage plan. So that's that chronic special needs plan for ESRD. Some hemologic disorders. They're talking about things like hemophilia, and there's sickle cell, and there's a few others. HIV and AIDS, there's one for that. Chronic lung disorders, but we're looking at asthma, chronic bronchitis, pulmonary fibrosis, pulmonary hypertension. So there's a few that are allowed in there. Chronic and disabling mental health conditions. These could be like being bipolar, major depressive disorders, paranoid, schizophrenia. So those will have a special needs plan for them. Some of the neurological disorders like epilepsy or ALS. Okay. And let's see what's going on from there, like Huntington's, MS, Parkinson, spinal stenosis. I mean, so there's quite a few of the neurologic ones. And then stroke. Okay. So I always go back to looking at that ESRD, because what you will find is in many of these plans, you know, that you're still wind up paying 20% of the cost. And that was the typical thing with somebody with ESRD, is that they wanted a plan. You would never, unless you were just turning 65 and you were able to slip in under some open enrollment, you know, into one of the other plans out there, you know, where you had the open enrollment and you were able to get a MedSup, that would cover you. But for many people, that's just doesn't happen that way. They've got ESRD now, and they can't get into a Medicare Advantage plan. Well, if you got into one of these, you're still going to be paying 20% of the cost. But here's the big difference. Remember, one of the benefits of being in an Advantage plan was a maximum out of pocket. So even going with the worst case, because the maximum that you're allowed to use these days is $6,700. Okay, the average cost for ESD is about $14,000 per year. So you could see that that's going to be a savings of $7,000 to $8,000 just because you would reach your max out of pocket. Okay, so you get some real benefits of being able to enroll in one of these type of plans. Now, they're not going to just take your word for it. So you're going to have to submit a letter, and each of the carriers will have one on their website that you can download. And you'll take that letter and have it signed by their doctor, or they will take it, not you personally, and send that in before the plan will go into effect. So they need that verification of the illness prior to letting them enroll. Okay. So that's our two plans, both the dual eligible and the chronic needs. If you do have any questions, feel free to email us over at training, and that's usually going to be training@ahpcsales.com, and we'll be glad to answer any questions for you. So with that, I will let you go. Have good luck out there, and hope this was very beneficial for you and really gives you some new opportunities, at least in the creation of a SEP, to be able to enroll people. So good luck and happy selling.